Hello and welcome to Health Live at Seniors Today. There are scores of days and months that are observed through the year, and a lot of them are around health. And the month of November may not be observed as much in India, but in the US, it is the National Caregivers Month. And we thought it would be appropriate to have a special session on caregiving. And for that, we have invited today Dr. Bikky Chaurasia. Good evening, Dr. Chaurasia. You're on mute, doctor. You're on mute.
Yeah, hi.
Hi.
Good evening.
Good evening. So we are delighted to have here with us Dr. Bikky Chaurasia, who is consultant internal medicine at the Kokilaben Dhirubhai Ambani Hospital, which is in Andheri in Mumbai. Before I invite him to speak, I will just do a brief introduction.
Yeah, hi.
Yeah, hi. I'll just do a brief introduction to Dr. Chaurasia. Dr. Chaurasia is a consultant in internal medicine. I'm sorry, I'll just wait for him to be ready fully and then we'll start.
Sir, please allow us to share my screen now so I can present the PPT.
Yeah, just give me 2 minutes. We'll just do an introduction with you first. Yeah. So, sorry about this. So, yeah, once again, I'm welcoming Dr. Bikky Chaurasia. He is consultant internal medicine at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Dr. Chaurasia has completed his MBBS from MUHS Nasik and has done his master's degree in internal medicine from Vadodara. He's also done his fellowship in critical care medicine from a leading hospital in Mumbai. He's a certified diabetologist and infectious disease specialist from the Hinduja Hospital. His practice of internal interest is diabetes, thyroid disorders, critical care, infectious diseases, and geriatric disorders. As you're aware, as I mentioned earlier, the topic for today is on caregivings, and we've requested him to speak about supporting the supporter, tips for caregivers of seniors. And this is a very important topic for senior citizens. Welcome, Dr. Bikky Chaurasia.
Yes, sir. Good evening, sir.
Good evening.
Sir, please allow this very good, great opportunity to present me as for you guys. It's a great opportunity. Thanks for giving me sir opportunity. I would like to share my screen with you guys so I can present my PPT.
Yes, we've given you rights to share.
Please, sir, please.
Yeah, please go ahead.
Yeah, is it okay?
Yes, it's okay. All right.
Yeah. Am I audible?
Yes, you're audible, doctor. We are live now. We have over 100 people on the attendees list here and 700 people watching it on YouTube as we speak.
Okay, sure. So I should go ahead with my presentation today. Yeah, so topic for today is supporting the supporter. So tips for caregivers of seniors. As we know, when we approach the age of about 65, you are approaching toward a senior citizen group. So you need some help from your younger people or from your relative or your friends and family. But what about them, those who take care of the senior people? We salute them, those who take care of the senior people, the disabled people and other things. So this presentation is just for the people who just take care of the senior persons. So they also have to take care of themselves. So moving ahead, so caring for the elderly, it's already divided in 3 parts: caring them mentally, caring them physically, dealing with the resistance. So your body requires physical, mental care along with your dealing with, and you also dealing with the resistance. Resistance means some people don't like to give a good care, but still they want to give it because there are some perspective or some other things in their body. Some patients, some people are not physically good enough to give the care, but still they have to do it because they are their families and friends. And some persons are also mentally disturbed, but still they have to give the care to the senior person mentally because they want them to for their well-being. So caregiving is a rewarding, but also sometimes stressful. So caregiving can have many rewards. For most caregivers, caring for a loved one feels good and can make your relationship stronger, as nicely said. But the demands of caregiving also causes emotional and physical stress. So it's common to feel angry, frustrated, worn out, or sad, and it's common to feel alone. Caregiver stress can put caregivers at risk of changes in their own health. As rightly said, sometimes you might feel angry, frustrated, worn out, or sad because you are also a human being. हर एक को अपना अपना प्रॉब्लम्स रहता है हर एक की लाइफ में दे फील लेथार्जिक दे फील फ्रस्ट्रेटेड तो कभी ना कभी गुस्सा मेंटली फिजिकली इमोशनली शुड आता है कहीं ना कहीं आई माय प्रेजेंटेशन विल बी हिंदी एंड इंग्लिश बोथ ताकि एटलीस्ट एवरीबॉडी शुड अंडरस्टैंड द थिंग्स ओके so we should always be a we should always give a positive thumbs up for the caregiver who gives caregiving to senior citizens. So now what are the concerns for the caregivers? So concerns are they must land up in anxiety, depression, irritability because of the continued stress they are dealing with in their life. Sometimes they also feel tired. They are having suffer from insomnia. They don't get sleep. They have to wake up whole night or in between the night. They have to rush for the help. They also have some underlying comorbidities because of they could not take care of your own body. So their underlying comorbid health problem worsens slowly. They don't call. Sometimes they have trouble concentrating on their own job and own work. Sometimes in a frustration or emotional breakdown, they start drinking, smoking, or eating more, binge eating. They put up the weight. They also sometimes neglect the responsibilities also because they are already responsible for the senior person, those who are taking care of them. So what are the caregiver stress? So becoming easily irritated or angry, feeling overwhelmed or constantly worried, experiencing periods of high blood pressure, grinding your teeth at night, having difficulty sleeping, being forgetful, trouble concentrating, feeling heart palpitation. These are the stress markers. They feel sometimes uneasiness. बोलते डॉक्टर साहब मेरा दिल घबरा रहा है मुझे नींद नहीं आ रही है मेरा बीपी शूट अप हो गया है मुझे गुस्सा आ रहा है ये these are very common things which we hear daily on a routine basis. What are the burnouts? Being late for work because उनको रात रात भर जागना पड़ता है. They have to take care of the person they are handling. They go late to their job. Boss से डांट सुनना. Experiencing decreased sexual desire because they are completely fatigued and stressed out. So sexual desire also are on the lesser side. Loss of energy, withdrawing socially. They don't have time, so they don't meet their family, friends, and relatives. Thinking resentfully, drinking, smoking habits get starting. Experiencing apathy. So third part is comparison fatigue. So feeling hopelessness, meaninglessness, having chronic stomach or bowel problems because they don't get sleep. They are tired. Their hormone level changes in the body. So they get acid reflux disease, gastritis, constipations, frequent headache. They also drop out from societies, avoiding their friends and family for their work, thinking of suicide and sometimes also escape also. These are the things which we have seen in a routine thing, which we come to know. That's why I'm present in front of you. So factors that can increase caregiver stress: caring for a spouse along with the senior person, living with a person who needs care, caring for someone who needs constant care. They also feel alone, feeling depressed. They have money problem, emotional problem, social problem. They have to spend extra hours beside their working hours to the person who they are taking care of them. Having too little guidance from healthcare professional, not having good coping or problem solving skills, feeling the need to give care at all times. Tips to manage caregiver stress: ask for and accept help. Always on when you are in stressed out, when you need help, always ask for help. First thing is to ask for help. So how do you ask for help? Make a list of tasks others can help with, like talking walks with your loved one or cooking meals, and let them choose how to assist. Focus on what you can do. Caregiver can give overwhelming, but remember, no one is perfect. So trust that you are doing your best. Always trust on yourself is the most important in your life. Always give your best and do the best. Rest depends on the God and your luck. Set goals you can reach. Make list of what's important tasks. Break larger tasks into smaller manageable steps. Prioritize important tasks and follow a routine. Politely decline requests that feel too draining. सिंपल फंडा इज जस्ट मेक योर डेली रूटीन एक्टिविटी शेड्यूल कि आपको मॉर्निंग में क्या करना है, आपको आफ्टरनून में क्या करना है, आपको इवनिंग में क्या करना है, और आप कैसे कैसे टाइम पे कैसे मैनेज कर सकते हैं चीजें. आप अपना बेस्ट दो, भगवान आप पे सब कुछ आपके साथ भी रहेगा और अच्छे से करेगा. सो आपके पास अगर बहुत बड़ा टास्क है तो आप उसे छोटे छोटे पार्ट में ब्रेक करके करो. आपको लग रहा है टास्क बहुत ज्यादा ड्रेन आउट है जिसमें से नहीं होगा, तो उसको आप पहले अवॉइड कर दो प्यार से बोल के, बिगड़ लड़े झगड़े गुस्से से. Ways to cope up with compassion fatigue. Do yoga. As we said, yoga and meditation best medicine to avoid stress and fatigue and for the weight loss. Exercise regularly. So 30 minutes to 45 minutes daily walk for 5 days a week is a must. Eat healthy. Eat more of protein, less of carbohydrate, less of oily foods. Eat balanced, nutritious diet. More of fruits and vegetables and fibers. Avoid eating outside oily food and junk food. Get quality of rest. So sleep, quality of sleep is more important than quantity of sleep. Many times my patients ask how much quality of sleep, how much hours of sleep is important. I always say them good quality of sleep is important than the quantity. So good quality of 6 to 8 hours of sleep is enough for a normal person, in a normal human being. Sign up for a caregiving support group. So you can sign up, you can make a group on WhatsApp, Google, and wherever. Practice self-compassion. Set your goals, emotional goal, functional goal, financial goals. Consider resilience, schedule a respite care. Now, what are the complications of caregiver burnouts? Poor health. They are not able to manage their sugars, their blood pressure. Sometimes they become non-compliant to the medicine. They don't visit doctors because they don't have time. Because of the anxiety and frustration, they also abuse elder also. They have persistent fatigueness, pain in the bone, joints, muscle, because of constant working in their home. They are addicted, they have sometimes smoking alcohol, other thing, tobacco. They sometimes land with depression because of all the things. So things to keep in mind while caregiving to seniors. Keep your loved one always active. You should always love your loved one by heart, by each and every week. Keep an eye on their physical, mental health. Always keep an eye. They are taking their medicine properly or not. They are sleeping well or not. They are changing their diapers or not. They should not pass the stool urine on the bedside. They should go to the bathroom. Help them go to the bathroom. Help them by bathing them. Make sure they should eat proper diet, nutritious diet, and they should also do some kind of yoga, exercise, whatever their body and age allows. Get help with the driving, discuss finances also. Discuss with them the finance also, how much money is required now, what to do, what is the next step, how can we do a saving and what to do and what next to do. Discuss the legal issues with them. As you know, the legal part is most important. Find shared meals or make food for them. Always cooking food for a loved one is the best thing you can do. Because a wife cook for the husband, so we should also cook for our loved one. Consider home caregiver to help the elderly person. Consider senior home or center. If you don't have a small house, you can consider senior home or a center where old age people lives, and they should take a good care of them if you are not able to care. Impact of caregiver burnout. Caregiver burnout can cause mental health issues like depression and anxiety and weaken immune system. So they require multiple vitamins. Weaken immune system, they frequently get cough, cold, fever, muscle ache, other vitamin deficiency. Burnout can compromise care quality, posing health risks to seniors. Physical symptoms may include fatigueness, sleepiness, insomnia, decrease of appetite, loss of appetite, increase in weight gain. Burnout caregivers may isolate themselves, causing seniors to experience social isolation and loneliness and worsening depression. Burnout can cause social withdrawal, irritability, and in severe cases, thought of self-harm, suicidal. Respite care. You have been hearing respite care in my few of the last slides, so I'll just now explain what is the respite care. It may be heard that you leave your loved one in someone else's care, but taking a break can be one of the best things you do for yourself and person you are caring for. Types of respite care include in-home respite, healthcare aids, home to your home to spend time with your loved one, or give nursing advice or both. Adult care center and program, they are center that give good care for their older adults. Some also care for young children. Two groups might spend time together. Short-term nursing homes, we have seen many small nursing, they take care of the old age people and senior citizens. Some assisted living homes, memory care homes, and nursing home accept people who need care for short stay, but caregivers are away. Respite care is taking break from your general duty, because as you know, working a whole days and weeks and months, your body also needs a rest, relaxation, and a break. So early detection is the key to prevention. Always, as a doctor, we say early detection is always key to the prevention. So now, how do you know that there is a warning signs of heart attack? So if you see any pain, pressure, or tightness in one of your most these areas, such as chest, retrosternal area near the nipples, left arm, shoulder, back, jaw, neck, you may also feel short of breath, feeling breathlessness, tired, fatigueness, dizzy, sweaty, sick, then you should call 108 emergency number, or maybe call the near, or you have to rush to a nearby hospital or doctor who is available. These are the signs and warning signs of heart attack. In हिंदी इसी में किसी भी क्षेत्र में दर्द, दबाव या जकड़न हो, जैसे सीना, बाजू, कंधा, कमर, गर्दन या जबड़ा, तो आपको अपने नजदीकी डॉक्टर के पास, हॉस्पिटल के पास 108 पे कॉल करना है आपको। या आपको अचानक से पसीना छूट रहा है, या आप अचानक से बेहोश हो गए हो, या चक्कर आ रहा है, तुरंत आपको डॉक्टर या हॉस्पिटल के पास रश करना है। ये अर्ली साइंस हो सकता है हार्ट अटैक के, तो आपको ध्यान देना है, सतर्क रहना है हमेशा। वार्निंग साइंस ऑफ डायबिटीज, फ्रीक्वेंट यूरिनेशन, पेशाब ज्यादा आना, प्यास ज्यादा लगना, आपके घाव वुंड नहीं होना, स्लो हीलिंग वुंड, हाथ पैर में नमनेस आना, टिंगलिंग होना, प्यास लगना, मुंह ड्राई होना, अचानक से वेट लॉस होना, बार बार बॉडी में यूरिन इन्फेक्शन होना, बार बार फटीगनेस होना, कमजोरी लगना, आंखों के सामने अंधेरा छाना, स्किन अचानक डार्क कलर होना, मुंह का स्मेल चेंज होना, बास आना, मुंह से ब्रेथ ऑर्डर. These are all the early signs of diabetes. So any of the signs, you just visit your nearest local doctor or MD physician or nearest hospital for further evaluation management. Now stroke. Acting fast. F-A-R-S-T. F is face, A is arm, S is speech, T is T. Type. So does anyone see one face drooping, or when you smile or you clench your teeth, you always have to rush to the emergency to the hospital nearby. One arm drift, you are not able to drift your arm, you are not able to pull up your arm, then you need to, then this must be a sign of stroke. So rush to the nearest hospital doctor. If while talking you experience any slurring of the speech or any slurred speech, you are unable to speak, there is aphasia, immediately rush to the nearest hospital, or you call just 911 according to CDC guidelines. Symptoms to monitor for mental health issues among elderly. So these are the psychiatric disorder which they are suffering from. Bipolar disorder, alternate mood is always high, sometimes low. Substance abuse disorder, tobacco, drugs, or anything. Personality disorder, OCDs, dissociative disorders, post-traumatic stress disorder from the family, schizophrenia, schizophrenic affective disorder, eating disorder. So issues always decision making, suffering from hallucination, delusion, staying anxious all the time, tiredness for no reason, concern with memory. So these may be the early signs of mental health issues in elderly. So what disease we see in elderly are Parkinson, stroke, mental health disease, diabetes, blood pressure, heart disease. Now coming to the Parkinson disease, whenever see a old man, old woman walking like stoop, like stop baby steps, we say it's a Parkinson disease. They have a mask-like face. There is no expression on the face. Stoop posture, back rigidity, fixed elbows and wrist, forward tilt of trunk, reduced arm swing, hand tremors, trembling, slightly flexed hip and knees, shuffling short step, gait, tremors in the legs. This is a typical of Parkinson. If you see any of the symptoms, then you are landing up in Parkinson disease. Parkinson disease is an old age disease which is treatable with the medicine, but the symptoms can be controlled with the medicine. Now coming to the Alzheimer's disease, we have seen a movie Ajay Devgn and Kajol where Kajol suffers from Alzheimer. She achance forgot while crossing the road who is she, where is she. So there is Alzheimer's disease. So there is a memory loss. You always misplace or item, don't remember where you have kept the keys, where you have kept the pen. Difficult in decision making. If anybody asks you, you are completely blank. Reduce the ability to understand the visual images. You don't recognize the signals also. Confusion with time and place, mood swings, repetitive speech and writing issues. You don't write because your hand trembles. Difficulty in problem solving, your body gets slowed down, so you don't solve the problem easily. You always isolate yourself from the social people. You don't go to a gathering. You don't like the overcrowding. Inability to complete the complete task. Simple tasks are given, you are not able to complete. So 1 in 5 people don't know the warning signs of heart attack. If you or someone you know or care for are experiencing the warning signs of heart attack or previously discussed signs of symptom, immediately call an emergency medical number, ambulance, doctor, hospital, wherever. You have to rush immediately. Time is precious in heart attack, in stroke. Okay, it's always a golden hours. Home safety checklist, bathroom safety always for the elderly, install a shower bench for seniors who have trouble standing, non-skid mats or strips to prevent sleeping, clearly marked lever handles for hand-to-hand turn faucets, install grab bars in toilet and showers, consider walk-in tub for seniors who have trouble getting the bath, install a raised toilet seat to help with standing and bending. What are the kitchen safeties you need to take care of their home? Install automatic shut-off timers for ovens and stoves. Move curtains, paper towels, and fire hazards from the range. Add lever handles and temperature controls of faucets. Install finger safe garbage and disposal covers. Consider pull down shelves or move most. Use product forward. Keep knives and sharp set in blocks and holder not loose. Bedroom safety. Install bed rails and adjust bed height for all fall prevention. If you get a fall, there can be a head injury, you can land in coma also. Remove trips, hazard like area rugs and cords. Install accessible light sources near the bed and nights. Place medical alert device and charger near bed. Set up bedside toilet if needed. Add a study chair for dressing and support. Communication with various healthcare stakeholders. Effective communication with healthcare providers is important for a variety of reasons. Always you should make a remember, either it's a wife, it's your brother, it's your sister, it's your any family member. Always communication should be the proper way. Communication can solve all the problems. So patient safety should be discussed. Effective communication helps prevent mistakes and ensure patients receive the best care. Patient satisfaction. Patients are most satisfied when they feel their healthcare providers empathic and place them at center of the care. Improved outcomes. Effective communication can lead to improved patient's outcome. Positive atmosphere creates always positive vibes in the body. So openly acknowledging and resolving issues can maintain positive atmosphere in the facility. Smooth running of the healthcare setting and open communication culture can help make the healthcare sector running more smoothly. Active listening. Nurses use the active listening to create an open, honest conversation with the patient. Empathy. They always have empathy and care towards the patient. Clear explanation. You should always explain details, what things you are providing, what things you are always, any procedure, anything you need to explain them very well. The importance of medication management and elderly care. Aging increases like likelihood of needing medication for various health conditions. People often face challenges like multiple prescription. They go to multiple doctors, neuro, cardio, nephro, physician. So they have a multiple prescription. So they forgot which prescription to follow, where they kept the prescription, where is the drug. So they are very non-compliant. Dosages. Many different doctors will have different doses of the medicine. So they should always adhere to the medication schedule. Proper medication management becomes essential to ensure the treatment effectiveness, minimize risk associated with polypharmacy, using multiple medication. Always there is a simple funda in medical field: do no harm. So do no harm. If you don't know anything, ask for the help. Otherwise, don't self-harm yourself. The importance of medication management, elderly care, correct medication prescribed for right conditions been taken. You need to take care and recheck the thing. Medicine is right as per age and diagnosis. Correct dosage used and specified duration the doctor has prescribed. Managing medication. Step older adults can take to manage medications. So keep an update list of all medications, supplements, and vitamins you are taking. Regular review of medication with a doctor. Keep a regular follow-up every 3 months. Check with doctor. They make a clinical examination. Make your notes. You can keep a dabba. Right now, the markets there are different types of medicine pill boxes available where you can take the date, time, and everything. Take your medication properly on time. 50% of senior citizens are not taking the medication properly. There are barriers to taking the medication, which can range from print on medication print to smaller and unclear. The packaging is too tight. They couldn't read. The pills are size are very small. Preventing this barrier can be done by talking to a medical provider. So if you are experiencing any barrier to taking a medication properly, call your doctor or pharmacist. A medical provider might help you out how to take the medication, distribute supplies that make your packaging easier to open. Furthermore, they can address concern over side effects and clarify any uncertainties about the medication. So by this, I will finish my presentation today. And
thank you, doctor. Thank you very much for this session, and thank you to Kokilaben Hospital to facilitate this. There are a few questions that have come in, and I just want to take it. Request you to answer it.
Yeah, I have only 5 minutes. My patients are lying down. Rest questions you can just mail me on my mail ID. Okay. As I've discussed with the Madhuri, I would.
I know. We have a live.
Sure. So please ask me the question. Yeah.
What is better, to hire a trained person or a loving, untrained person to take care of an elderly person?
See, always a trained person is better.
Can you put off the screen share, please?
Yeah, now can you see me?
Yeah, well, the screen share is still on.
Okay. I don't know where that guy has.
Yeah.
So if you have an option, then best is the love person who can take care of you and you need to train them. If the love person is nearby, who can take care of you, that is always better one, because they will get trained automatically. If they love you, they will get trained automatically. Okay. Yeah. But if you don't have any options, then you have to hire the nurses, brothers, which are available for the hourly basis.
Are there any organizations pan-India which, there's a question from Mr. Anil Singh, any organization pan-India that is available who provide experienced support staff for caring of seniors? Other than nurses?
There are some NGOs, but I don't know what are that. But I've been hearing with my patients, there are some NGOs, they're helping the senior citizens in Mumbai.
Yeah, well, we have people from all India. Do medical facilities like yourself, like Kokilaben Hospital, and doctors like yourself, do take time out, or is there any provision to provide advice to caretakers, to caregivers?
See, whenever we go for the rounds now, we see very many old patients. They are taken care by the caretakers. So we just guide them out what to do and what not to do. All the everything, do's and don'ts to the caretaker, because the relatives just come for a day or two. Rest all the life they have to be taken care by the caretaker only. So we just provide them a counseling part done by the doctors only. During my rounds, I personally do. I guide them out how to take care of the older people and other things. This is what we do.
But there's no organized advisory service?
No, there's no organized such nothing.
Well, thank you, doctor. I know you don't have time for us today, but that's all right. We will, we do have sessions on an every week basis. Next week, we have a special session on Crohn's disease as well as irregular bowel disease from Dr. Prasanna Shah of Breach Candy Hospital. He'll be there tomorrow at 5, next Saturday at 5 p.m. So please be there. And I'm sorry, we have an early session today, which is ending early. It wasn't planned this way, but be that as it may, thank you very much to Dr. Bikky Chaurasia.
Thank you.
And thank you to all of you. We will be back next Saturday at 5 p.m.
Sure. Thanks a lot, sir. Thanks a lot for giving me such opportunity. Thank you.